This is the cerebral aneurysm project. The cerebral aneurysm, also known as the brain aneurysm, is a weak or thin spot on the brain that balloons or bulges out and fills in with blood. It affects only in the brain, which causes pressure to the brain to burst or spill out blood into surrounding tissue known as the hemorrhage. That can lead to health issue problems such as stroke, coma, brain damage, and even death. There are three types of disease: the saccular, fusion form, and mycotic. The cause is transmitted by the blood into your blood vessels that escapes from the aneurysm and spreads out into the brain surface. The bleeding can cause some serious damage. It affected an estimate of 6.7 million people in the United States, mostly affect after the age of 40, a certain ethnic group of Hispanics and non-Hispanic blacks, most likely to experience it, while white patients show a higher rate of unerupted aneurysm. The mortality rate, about 20% of people who got cerebral aneurysm died within 24 hours, 50% of people died in 3 months due with complications, and 66% of people did survive with some recovery or no disability. Cerebral aneurysm does not show any signs and symptoms until they become very large or ruptured. That can lead the tissue and nerves to cause pain in the eyes, numbness, weakness, paralyzed on one side of the face, dilated pupil in the eye, vision change, and or double vision. The way we can find a diagnosis, we can use the CT, which is a scan, quick image to detect the bleeding and identify the aneurysm, and MRI to provide more and better details of the image to the brain and blood vessels. The MRA, which is a special type of the MRI that focuses on the blood vessels. The CTA that can combine the CT scanning and the angiography for vascular image. The angiography is the catheter that insert into the blood vessel, allowing for contrast dyed image to visualize the aneurysm in detail, and the neurological assessment that can conduct to evaluate cognitive abilities and neurological function. There are some ways we can treat this disease. We can observating the monitor without any treatment, do some medications, surgery, endovascular, stenting, and flow diversion. There is a cure for this disease. It's unrupted aneurysm. It can affect the treatment. However, it reduces a rupture risk, and rupture aneurysm, which the treatment is crucial recovery and is possible, but it may arise. While not all cerebral aneurysms can be prevented, there are some ways you can do to not have this disease. You can control your blood pressure by monitoring or go through a healthy diet, avoid smoking, limit the alcohol, manage stress, and to do a medical checkup.